Well, thank you all very much for turning up. I'm sorry we're 3 minutes late. It's my fault. I was gossiping with the Chief Executive, so you can blame the pair of us for that late start. Before we start the formal business, I'm sure you'd all join me in wishing Councillor Brian Clark all the best for a speedy recovery. Tremendous shame that he's not here tonight. We all wish him well, and I'm sure you all join me with those remarks. Councillor McNay, do you want to go first?
In the news recently, it was stated that 20% of elderly residents are placed by local authorities in homes that are judged at best to be average. Are there any practical strategies to ensure improvements?
Yes, Chair, I think it's an absolutely fantastic question because certainly in my last authority, we supported about 1,000 people at any one time in older people in residential and nursing homes, and one of the things I was constantly saying was we're not just parking those people there and forgetting about them, and certainly we shouldn't do. What we need to do is to make sure that we only purchase places in the better quality homes, but that we also work with the sector, the independent sector that provides the vast majority of care these days up and down the country, to help them drive up the quality of what they do, and also think about what might incentivise them to do that. And then, having done that, check that actually what we're getting is what we're paying for. And what we're paying for should be high quality care where people's dignity is preserved. Dignity is the yardstick. The main concern I have is where councils, for understandable reasons around budgets, try to drive the price down so low that no provider could reasonably be expected to deliver what I think most of us want for people who do go into a residential or nursing care home. So it's a very difficult issue around price. We're clearly looking for best value, we're looking for value for money. But certainly we need strategies that are clear with providers about what we expect, appropriate pricing mechanisms, and then checking that what we're getting is what we're paying for and what we want for those people. I did check this morning whether Cheshire County Council's performance is better than the average on that 20%. It would seem that it is. It would appear from the information that I was able to pick up this morning that we're not contracting with any home that is in the poor category, certainly as far as the Cheshire Western and Chester area is concerned. And the numbers of homes in the adequate box was significantly less than that 20%. But I didn't know what I was going to find in checking that. But clearly what we want to move towards is where we're only contracting with homes classified as good or excellent.
A recent report on abuse of the elderly, and this is something the Chairman touched on this evening, suggests that 90% of elderly people who suffer financial, mental or physical abuse go unnoticed by social services. And I should say that this figure does not include those in residential homes or with dementia. What ideas are you pursuing for making sure that figures in our area are considerably better?
I think one of the difficulties is that, again, I was thinking this morning about the issues that we might be discussing tonight in terms of the greater detail. It is really difficult to get hard evidence about prevalence. There's a lot more mistreatment of vulnerable adults than we used to care to think. I think that's probably something we can say with little with little doubt. I do think the answer in terms of how we go forward is about some of those things I touched on in the presentation. Clearly it is about making sure that adult social care gets its act together, but also that we get a complete council-wide response, that we work with partner agencies, that we get a robust safeguarding board that works effectively with the police, with all those other agencies, and we get our multi-agency policies and procedures working properly, and that we do a lot more about raising the profile with the wider public. And, back to that theme of it's everybody's business, and encouraging people to have the confidence and making sure that people actually know what to do, what number to ring if you pick the phone up and you want to actually talk to us. I think so-and-so over the road or wherever is being mistreated. It might be financially, it might be physically, it might be sexually, there are all sorts of ways. And sometimes it falls short of criminality, but nevertheless, it needs to be addressed. We need to make sure that people out there know what to do. So there is a lot of, if you like, marketing that's required in order for us to get nationally where we want to be, but we need to take our responsibilities for Cheshire West and Chester accordingly.
New human rights laws mean that elderly and vulnerable residents of care homes must have a detailed mental health assessment to check that they're not being unlawfully kept in hospitals or nursing homes. And these laws, like us, come into effect on April the 1st. Are we organised to send in doctors and workers to all the homes where we have placed residents?
Chair, this refers to the new deprivation of liberty safeguards that are coming in on the 1st of April, following an amendment to the Mental Capacity Act, and it responds to something known as the Bournemouth judgment that went back 10 years or so. It is a very important policy development. My judgment is that Cheshire County Council has already put most of what's required in place. I think there is perhaps a little bit more work to do in terms of making sure that we have a supply of doctors to do their part. But I've had a look at, before I came into post, I've had a look at, because in my previous borough we were having to implement the same legislation, but I've had quite a lot of conversations with the lead officer in the County Council, and I'm satisfied that good progress is being made, and that in April we will be ready to discharge those responsibilities.